Alhamdulillah.
Alhamdulillah. Okay, Dr. Dalia, please introduce yourself.
Okay, I'm Dr. Dalia Abu Noor. I'm I wait I have been away from medicine for a while because of some personal reasons. So that's why it was much difficult for me to go through this exam, and it always was an issue for me. But finally, alhamdulillah, it happened.
Alhamdulillah. Dr. Dalia, your PACES story wasn't usual. Yes,
Yes, yes,
it,
yes.
it
It
was
was along.
full of tears and
Yes,
sweat.
because it's not it's not my first time, and because every time I lost hope and I lost confidence in myself. But my advice for everyone is this exam is not you. You have to be confident about yourself. And even my last time, I didn't change anything about myself. And even in my studying, it was a very, very short time because I got a seat in a very late time, and I have a lot of personal issues happened in this time. But the only thing that it changed it was me, my self confidence, with which make a huge difference in the exam.
Okay, okay. So actually, Dr. Dalia, you know that your main like obstacle was that you lost your faith in yourself at one point. You thought
Yes,
that
yes,
yes, to pass the exam, you need to be working, really
yes.
working in medicine and seeing patients every day. Yes.
Yes, yes, this was a big issue for me, and it's my advice for all the females who have to be away from medicine for any reason. It's not difficult, and you can be back anytime, and it's only in our mind. I know some of my friends who was working in Germany after maybe 12 years of after not practicing medicine, and they are accepting this, and they practicing, and everything is going well. So it's not the issue. The issue is all about to be confident and to prepare yourself well for the exam. This is the only thing that make a huge difference in the result.
Okay. So Dr. Dalia, tell us about the PACES preparation, like from the start, and please summarize the journey. If you are like imagine, يعني advising someone to have like a shortcut to prepare this exam, maybe in 3 to 6 months, how they should go.
Yes, the most important thing for me is to be organized, to know what is the exam is about, and to organize yourself. Just study like you want to give the examiner what he wants to hear from you, not your knowledge, not your previous experience, not anything. Just to know what the examiner wants from you. The clinical course, it's important to see cases in the courses, in the clinical courses, and for the preparation, I think we got everything in your course. As you know, I have been for a while in these paces, and I took many courses. But honestly, your course is the only courses that have all the communication and have all the long consultation ideas and the differential diagnosis and all of this. So if I'm giving advice for anyone to prepare in this short, to know good differential diagnosis, to see patients as much as you can in the clinical courses, and to try to collect as much as you can from the communication courses because it is repeating itself in the exam. Even
Okay.
myself, I got one case two times in the exam.
Oh, yes, yes,
Yes.
you're an expert. Yes, yes.
Yeah.
Okay. So tell us about the last days before the exam.
The last days, it was a night actually, so I was celebrating with my family. But the most important thing that I was revising the differential diagnosis, the notes for the clinical course actually, and the communication, the important points like for the medical error, I have to make the 4A like this, everything I need to know before entering the exam, to summarize as much as I can to collect most of the information.
Okay, fair enough. Okay, so Dr. Dalia, please tell us about the cases you got during your last examination in Egypt.
Okay, my first case, I entered on long consultation case. It was about from outside. It was about the bleeding from gum. And after entering inside, it was a patient who was taking warfarin, and she has prosthetic valve. And she is also having on examination. I could find a rash on her legs, and yes, and she got an infection a few days ago, and she have taken antibiotic. So the case overall was a good one. The discussion was a little bit full of questions. They were asking about everything, literally everything. Even when the investigations, I said I want to make CBC. She asked me why you want to make the CBC. So this was my impression in the last exam. They are not missing anything you are saying until discuss you about it.
Yes, so not to
Uh,
mention anything unless you know why you ordered this lab.
Yes, it took me a second to tell her, yes, I need to make CPC to exclude pancytopenia rather than to be a platelet deficiency. And she was happy with this answer because she wanted to know because the differential here was maybe warfarin toxicity, maybe ITP because of the rash in her legs. So she wanted to know every investigation for each investigation for every differential in the case.
Okay.
And I think this is mostly the discussion. She asked me. She was asking a lot of questions in the discussion. Actually, she asked me, "What if it is warfarin toxicity? What will you do? What if the INR was normal? What will you do?" She was going through a lot of details actually.
Okay. Okay. And she needed from you a wide range of differential diagnosis, not an
Yes.
exact diagnosis.
Not an exact diagnosis, but the first two differentials, she was concentrating about it, and she was asking a lot of questions of, okay, she told me, yes, okay, if it is warfarin toxicity, what will you do? Will you substitute warfarin with another medication? And after taking a lot of discussion about warfarin toxicity, she shifted to the ITP. What if it is the INR was normal? What will you do? And what will you give the patient? And she was asking mainly about those differentials.
Okay. Okay. And the patient was having valve replacement?
Yes, she was having midline stenotomy scar and valve replacement, and she was having a rash on her legs also, which goes with the ITP.
Okay. Okay. And the next case?
The next case, I think I went for the short cases for the the cardiology. It was mitral valve replacement. There was no AF or anything. It was a good case. And the other case was the neuro with Parkinson's disease. And also they kept asking a lot of questions in the discussion. And
Okay.
they needed exact diagnosis because they asked me when I started, what will you do for this patient? I told them that in the investigation, I want to make INR. They asked me why INR, sorry, MRI. So I told them yes, because I need to exclude any vascular cause. They told me what else? I told them that it's mainly it's a clinical diagnosis. They were okay, and they asked he's falling now. What will you do with him? What would you give him? They were kind. Actually, they asked me a lot of questions, and after getting out, I thought they would give me a very bad mark, but they give me 20 out of 20.
Very good.
Thanks God.
Yes.
Yes, the next case was communication. It was a pilot with pneumothorax. It is a common case, and it actually appeared for me in the previous time. Who was a smoker and he quit smoking and he's coming now because he want to go to work and about when he can work again and all these concerns and about if this was related to if he is previous smoker or not. This
Okay.
was a communication case,
Yes.
and the other case was the chest case. It was fibrosis with some obstructive signs. It was also not bad. It was a good one.
Okay.
Then I went for the other long consultation case. From outside, it was hypertension with hypokalemia.
Oh, yes.
And from inside, there was the family history of father also with uncontrolled hypertension. And I think there's no much in the examination. I could not find anything. And it was good, but they were asking about all the investigations when I told them the differential diagnosis was Crohn's and Liddle's, and I got adrenal artery stenosis and pheochromocytoma. And we started the investigations. They started to tell me what will you do. I told them renal aldosterone. They started to tell me what will be high, what will be low, what will be low, and a lot of questions really in this case also. But it was a good one also.
Yes, yes, yes. This is
Yes,
one of the famous cases. Yes, a case of
yes.
uncontrolled hypertension. Yes, and the last
Yes, and I
communication.
also asked it about, yes, the
Yes.
last communication, it was a big one. It doesn't have a lot of information. It just was you are speaking with a daughter about a condition of her mom. Her mom came with a stroke, and she's having weakness in her arm and leg, in her maybe right or left side, that I couldn't remember. And she was having nasogastric tube, and the doctors was sure that it was spotted in accurate position, but despite of this, she got aspiration, so they have to remove it for now. Oh, and they didn't mention what to do next. They just tell in the scenario to discuss the situation with her daughter. So she asked me, are you sure that the tube was put in a good position? It was a concern. And the other one was about if she is going to die because we have faith in God, and you can tell us. It was all about this. Nothing, nothing specific. It was just a big one.
Okay.
Hello?
Okay.
Yes.
Yes, yes, Dr. Adalia. Yes. Very good.
Yes.
Fair enough. So, how this exam was like different from every time?
The exam was not different. I think I was the one who is different from exam from everyone, because even I was a little bit sure that it's all about when God needs me to pass, I will pass. This was my feelings when I entered. Even when I get out from the last station in the exam, my colleagues told me more than once. They told me it looks like you passed the exam. I don't know why, but I think that. That I am the one who is different, but the exam is not that much difficult. That's my experience from the exam. All the exams are a little bit near from each other. Maybe the examiners are different. There are some examiners who are very tough. And I faced this in one station last night, in night one. They didn't like my examination technique because the patient was very acute and he was confused, and they made me lost all the sign, all the marks of the case. So the exam is the same, mostly is the same. Sometimes the examiners are different. That's from my experience. There are some tough examiners. But what matters finally is that when you are prepared, what can I tell that makes a huge difference from my experience is that to prepare yourself before entering the exam. In the few minutes you are sitting outside to prepare yourself and to organize yourself. What will you go inside? When will you go inside? What will you tell the examiners? That's really matter, because when you are organized from outside, you can present this inside with the examiners.
Yes, yes, very, very good, very nice advice. Okay, so if you want to give like a last advice, Dr. Dalia, this is the end of your PACES
Yes,
journey, which took you, I think,
alhamdulillah.
5 years.
The phases, I started maybe 2022. I took my first part, yes.
Yes, yes. So
Yes.
a last advice to summarize all this journey.
Yes, my last advice for the females mainly because I was having a problem in this. Be confident, don't be confused if you have even few years you are not practicing. It doesn't make a huge difference, but be confident and just be organized and know exactly what is the exam about in order not to waste time. And as much as you are organized, even in a few months, you can pass this exam.
Yes, yes. Thank you, Dr. Dalia, for this nice advice.
Thank you,
Yes, enjoy your
thank you
success.
so much.
Congratulations again. Thank you.
Thank you so much, Dr. Dai. Thank you for all your efforts. You were always here during this journey, through the tears and through the happiness. And I want to thank you personally for this.
Thank you, Dr. Dalia. Thank you, Dr. Dalia. You
Thank
are
you.
more than welcome.
Thank you.
Thank you. Thank
Thank
you.
you.
Okay. Dr. Tare, are you here? Okay.
Yes, Dr. Yes, yes,